30 hertz straight up.
Hello, thank you for tuning in to another wonderful episode of Lupus Has No Face, a podcast where we talk about real struggles, real life, and lupus and beyond. I am your host, Savannah Burks, today with our special guest, Miss Charlene, is in the building. We will be discussing blood markers and lab. Okay. So before we jump right into it, how was your ride on the way here?
It was excellent.
It was
How was
excellent.
yours?
It was good. I was here early today, way earlier than I normally am. So I must have some time on my hand or something. How was your day today?
Uh, Pretty busy.
Pretty busy. Consisting of
Clients, appointments, different things that I needed to get done for what I do.
and just to get a little bit in it, but not jump right into it. What is it that you do?
So we're here today. We're talking about lab. So I'm a laboratory director. I have a laboratory director's license, and um, I'm actually the person that will oversee the lab, oversee results, manage the phlebotomists, manage the laboratory technicians, manage the laboratory scientists. I would work directly with the pathologists to come up with the results for certain diseases.
Okay. And so I like to shine a light on anybody that comes on my show. So is you doing or are you doing anything in the community that you will like our supporters to know about? And if so, let them know what it is that you're doing, any dates that's coming up, and then we're gonna go ahead and have Tone drop the link or the social media tags in there. So you have anything that's coming up you want the people to know about?
Well, I do own a technical college, so I always have open enrollment for the school. So our calendar is online at the website. It's
And what is the website?
www.alliancehealth.org.
And when is the next class, or what's the deadline, for them to sign up?
We have open enrollment, so it's really not like a deadline.
Okay.
And our programs are funded by the state of Wisconsin. So we are a licensed technical college, can teach the same classes as MATC. And you get the same diploma that you would get from MATC.
And how many weeks or months or years is the program?
So our program focuses on short-term trainings. Most of our classes are anywhere from 4 weeks up to 6 weeks. And again, you get that same technical diploma that you would get if you were attending at the MATC or Gateway of the World.
That's pretty interesting because some of the stuff that you have told me that you teach in the laboratory, which you can probably name a few, right? Which is phlebotomy, is that correct?
So phlebotomy is the gateway to the lab. It is the front of the lab. That's where they draw the blood, collect the specimens, and they send those tubes to the back of the lab. So in the back of the lab, we will have what is called a medical laboratory assistant. So those are your specimen processors. They do the ascension for the specimens that are sent to the lab and get them to the correct departments. So you get the lab, you got the main lab in the front, and then you have all the other 5 labs that those specimens would be redirected to.
So I guess what I'm asking, since it's 5 different labs, is it 5 different degrees or certifications that you get, or is it under one? That's what I was asking.
So it could be 5 different labs depending on where you're working. So you have your chemistry lab, you got your
Okay.
microbiology lab, you can have it's different labs that you can have. It depends on, it could be hematology lab. So it's different spaces for different tests that are run within the lab. And so with that, you have your medical laboratory assistant, which is right behind the phlebotomist that just on grabbed all the specimens, and we're checking them in to make sure that they're scanned in correctly and we know which lab that they're going to go to. Then you have your medical laboratory technicians, which are the people that start the process to um, get that specimen in a different container if it needs to be, depending on what it is, and get it set up to be tested and put it into different analyzers that it would go in to have it tested. So then in the lab, you have your wave testing, then you got low complexity, mid complexity, and then you have your high level complexity testing. And so then we have what is called the medical laboratory scientists, which would do those high level complexity testing.
Yeah.
So when we're talking about the DNAs of the world and different things like that, you will have a medical laboratory scientist look at that.
The reason why I was asking what the names of the certificates or the degrees was versus MATC, because I know MATC do a longer course versus yours. And I know that you told me it was to get them to work faster, right?
MATC versus what I do?
Yes.
Yeah, so
The
we
students to get them to
so
work
technical
faster.
colleges were always designed to get individuals back into the workplace.
Yeah, that's what I
And
liked about your school, and that you basically teaching them what it is that they need to know, the necessary steps, but to get them to work faster and they don't have to take all those extra, courses that we had to do when we was in college back in the day.
right, so we cut out the fluff, and they come to my school and they get the meat and potatoes.
That
So
is
you
really
have
dope.
yes. So at MATC, you got your prereqs that you need to complete.
Yes.
And so they got to come in with those prereqs already done for us. And we take them right to the core of the course. Like MATC, you got prereqs and then you got your core. We get you right to the core, and we add some of those things in there, but not a lot of it. And so MATC program would be 16-week semesters. And they take 2 semesters, but it's all that fluff. Your last courses would be when you actually go into the lab and do your clinical through MATC. And so I actually did mine through there. So I'm very familiar with the process for the phlebotomy, the medical lab tech, and all of those. I did those through MATC. And so I'm like, okay, what if we can just get back to being technical colleges and give them that meat so they can go right back into the workforce?
That is so dope. I think today's age, a lot of our kids actually need that because their attention span. So to have something accelerated
Yes.
is very beneficial in today's world. So that's pretty dope.
Right. And one of the things that is missing from the laboratory sciences of the world is us. I don't see, as the laboratory manager, we didn't have a lot of minorities in the lab. So it's a field that I believe that everybody needs to get reintroduced and get accustomed to what actually happens in the lab, test result wise, and just to see those processes.
And that's why I felt it was a good thing to talk about today, because whether you behind the scenes or you're dealing with it and waiting on those results to come back, is what you don't know, right? As to why things are how they are. So when people hear genetic testing or biomarkers, it can sound overwhelming. Can you break down what that actually means in real life?
Genetics and biomarkers.
Yes.
So biomarkers, this is part of your DNA strands, how you function, what makes you who you are as a person. And certain biomarkers or chromosomes, different things like that, it gives you, it's just I'm going to say a code, so to speak.
Okay.
And so the best I can relate it to is like DNA. And so when we had COVID, you have your mRNA, and you had one, so one strand tells your DNA what to do, the messenger DNA, and then the other one basically receives that code and saying, okay, you gave me the message, this is what I'm going to do. And trying to put it in layman terms as possible.
No, I'm glad that you're actually doing that because these people will actually receive what you're saying. So I'm glad that you're doing that. I know it'd be pretty difficult
Yeah,
putting it in layman terms versus, but you're doing a pretty good job.
Yeah, thank you.
You're doing a pretty good job. You're doing a pretty good job. We're gonna move to understanding the science behind it, kept in real life, right? So, what exactly are biomarkers and why are they so important for people living with lupus like myself or any other chronic illness? You did kind of touch on what it was about, but the second part.
I have to get a little more technical.
I know that's
fine. So the biomarkers, again, is part of your DNA, and it just tells you, like, you can have a biomarker test done to see if it's a probable cause that I may have this disease. Like certain families have congestive heart failure. What's the probability of me getting this disease? Do I have the biomarker for it? Some women, when they are in latent pregnancy, they like, is it a probability that my child may come out with autism or something like that? Yeah, they do, because if I can prevent it or go pre-select my eggs and say, I don't want that one with Down syndrome or autism, and I'm gonna pick the eggs that are more healthier. And so you can kind of, without sounding offensive, play test tube, pick the right egg, and
that's that's some real stuff. That's not funny. It was funny, but that's like real stuff. That's kind of like,
but it's very true. People do it all the time.
Yeah, so, people do it all the time,
especially when you have kids later in life, and so they make sure that, later in life, I'm busy. I have a full life, and I may not have time to deal with what the universe is trying to give me, and so you may end up with a autistic or with some other disease, or and just I can't deal with it.
Okay,
laboratory is cut and dry.
Okay. How does genetic testing help doctors understand what's really going on inside of the body?
Say that again.
How does genetic testing help doctors understand what's really going on inside the body?
Genetic testing or just lab testing in general? I can speak more from a genetics is more of a specialty, and I'm not going to say not qualified, but so you have your specialists and then you have your generalists. I will be more of a general lab. Okay. Genetics is very specific.
Yes, it is.
So,
can you speak it on it from your lens?
I can, yeah, from a general lab standpoint. Yeah. So, if I'm going into my doctor, I got all these symptoms. Mm-hmm. And I go see my doctor. My doctor don't know what these symptoms are, because especially like with lupus, they are very general symptoms that could apply to any disease,
yes,
any autoimmune disease. Yes. And those tests are designed to test for multiple things. It could, and it could be, I don't know, something. I'm trying to think of a good disease as
cancer.
Let's
sickle cell.
Oh, yeah, okay. Yes, cancer, okay. Sickle cell, whatever.
Okay,
one of those. And so, but that you bring those up, and so, most autoimmune diseases cause a lot of inflammation, and so we could do what is called a ESR test, an erythrocyte sedimentation rate test.
Yeah,
that's just to see how much inflammation is in your body. But that's not necessarily telling me what disease is causing that inflammation. So you got your lupus, you got your sarcoidosis, you got even diabetes. So that test is meant to, it applies to so many different diseases.
Yeah.
It's not just a one size fits all. Like I gave you this, I did the ESR test. Now I have a confirmatory test saying that you got lupus.
So that's how you help the doctor, by doing that specific test, and that kind of gives them where to at least start from, like a starting point.
Yes, a starting point, and clinical presentation is actually your starting point. So it's what you go into your doctor and you tell the doctor what symptoms you're having. So those clinical presentations. So lupus, I'm tired, my joints hurt.
Yeah.
That could be arthritis.
Yeah. That could be anything,
It could
actually.
be anything.
For
So,
sure.
and that's another reason why it takes so long to get a diagnosis with those things as well, because they get the test is designed, the actual test is designed to ran up against a multitude of diseases, and so helping the doctor, so the doctor sends down all that information.
Yeah.
So I have access to the same chart that the doctor does. And so I'm thinking this, the doctor probably called. So we usually talk to the doctors a lot more than people actually think. So he'll be like, I sent this test down. I think this patient has this, that, or the other.
Yeah.
And tell me, what are the findings? And they will say, hey, it was positive for this. Should we add on? So we will tell the doctor, you maybe should add on this test, anticoagulation test, something along those lines to go with those tests to help him get a better understanding
For sure.
of what's actually going on inside your body.
For sure. Is lupus something or any other autoimmune disease that can be detected through genetic testing, or is it more complex than that?
Lupus, most autoimmune diseases are very complex.
Yeah.
I'm not going to say that it's not a one size fits all.
Yeah.
And so just as you come in with your different symptoms, so does everybody else. And it's not a one size fits all. You may have the fatigue and the joint pain and all of those, which in my ear, I'm already hearing arthritis.
Mm-hmm.
And so never even thinking down the line to a lupus. And so it's just is really what rabbit hole the doctor chooses to go down with the clinical presentations. And then the laboratory test is process of elimination for the doctor before he can get that confirmatory test that say, yes, she has 3 or more of these symptoms, and we're going to go down this hole and look at lupus.
Yeah, just to piggyback off from what you said, like somebody that went through the whole process, becoming diagnosed and then knowing and being in the field as of today. So I know, like, when I got diagnosed, no one knew anything. So when you say general, that's the thing that they were doing to me. They was doing process of elimination testing, because no one knew. They didn't know too much about lupus at that time, and right. The things that was happening, and it was multiple diseases that I could have had, but it wasn't it. You know what I'm saying? So they kept sending me home. So like you said, it was a process of elimination.
And usually that takes about 6 years to actually get a diagnosis.
Well, thank God it didn't take me 6 years. Some people
take longer.
Yeah.
Some people just leave and don't know what
and don't go back
and don't come back.
And see, for me, my body was fighting against itself so badly. So I didn't have to wait that long, so when I passed out and got in a coma and all of those things, that's when I woke up and they told me what I had. So thank God it didn't take me that long, but I was just saying that it could, like how you said, it could be very generalized. So now having it for over 28 years and, me being a nurse and, having the knowledge and stuff that I know in the Lupus Warriors, I know in today's world that you can say, oh, well, I'm having all these symptoms and I think it could be this, because now they will actually test you, and you do have that right. People don't know. Yes. You have the right to get asked to tell the doctors to test you for certain things because of genetics.
Right.
Yeah. So I just want to kind of throw that in there.
You're more at an advantage than a lot of patients because you went to school in the medical field, being a nurse. So you have more information than the average person that's coming into the doctor's office. And like you said, most people don't know that I can tell my doctor what tests I need ran instead of my doctors, because they're going to do that baseline test that they do for everybody.
Yes.
A CBC, a chem panel, a chemistry panel. They're going to do all those basic general tests for everybody. But that's the way they do medicine, to narrow it down to what, okay, these are your possibilities now. And so that takes a lot. It's very costly. But again, with you having more knowledge, that's probably one of the things that enable you to get quicker results And I'm pretty sure you did some research of your own to make sure, like, no, this ain't it. I ain't having that. And so I need you to run, even when I go to the doctor, I come into my doctor and I'll be like, I need you to order this, and that, because I know my symptoms.
Yeah.
And it's symptom checkers that they have on the internet too. Some of them work pretty well, some of them don't. You can put your symptoms in and then come up with the tests that relate to those systems. So.
And for you guys that do that, I'm gonna go with my what Dr. Knox be saying. AI is not your dang on doctor. You better go see a doctor because you can have a million different things and they can tell you about to die for the symptoms that you haven't. You know what I mean?
Absolutely.
Yeah, you go in with something.
Informed.
Yeah, you do.
Saying, these are my symptoms. I don't know what else.
For sure.
To look for.
For sure.
The symptom checker, not. I ain't telling AI to diagnose me. Diagnose if you got anxiety or anything like that. AI is going to definitely, absolutely drive you crazy with all the possibilities. Because now you got a computer analyzing all these symptoms, and so
making you think you only got 2 weeks to live.
Yeah, exactly.
Oh my God. Okay, we're going to move to the waiting game. So this goes to the people that get their outpatient, right? So you get your blood drawn and you waiting for all your stuff to come back. So let's talk about the part nobody likes, right? The waiting game. Why does it take or why do you think it takes so long to get results back?
I don't want to tell too many secrets, but there's a lot of factors that would play into getting your test results back. So we're human. The lab makes errors just like any other department. And so we are subject to the people that are working there. You might be having a bad day and forget to send it to one of those 5 labs. And so your test results could be sitting on the desk waiting for somebody. Your actual tube could be sitting on the desk waiting for somebody to send it to the right department. It could get lost in the tube system. Go to the wrong department. We have the ascension numbers, the barcodes that are on the tubes, and we try to keep track of them. Maybe I tripped at my desk and wasted your sample. And so
wow,
you don't want to hear the dirty.
No, I do. This is keeping it real right here. I never thought about that.
Oh yes, we human. I've seen so many things.
Oh my
Sip of wine. And so samples get lost all the time. They end up in the wrong department. They weren't processed accurately. It could be something as simple as the blood wasn't drawn correctly. We have tests. And so if you drew the blood and it's in a tube and you didn't invert those tubes, rock those tubes so they mix with the additive that is in the tube.
Yeah, for sure.
Now you don't have enough additive to blood ratio. And so we can't use it. It could clot. And we can't use it. Can't get no test results off. There's no way to unclot blood for us. There's a way, but we can't with the chemical. We can't do anything with it. So I'm getting way too deep into the.
No, this is what this is all about. Like people is going to watch this show, and you're going to be speaking to people like, oh, something that they just never knew.
And something as long as simple as me leaving that tourniquet on your arm too long. Now you got extra analytes, which is in layman terms, electrolytes. Now you got extra electrolytes in your blood. In your
no, educate me. I mean, I like to learn new things. I'm going to be looking up some stuff. I didn't know that if you leave a tourniquet on your arm for too long, that can mess up. Listen,
that throw off your
this is what results. I did not. I was not aware of that.
Yes, because now you got the tourniquet on. You got all these analytes piling up at the door. You put that needle in, and now you got excess stuff in there that shouldn't be in there, which throws off the test results. You can draw the blood in the wrong order and throw off your test results.
Wow. I mean,
so you got tubes that have potassium in it. You got coagulation tubes. If I draw a coagulation tube, which is looking for clotting time in how long it takes your blood to clot. So if I draw that blue tube before I draw the tube that needs that to get your complete blood panel, now your red blood cells gonna get broke up. How I'm gonna do a CBC? How I'm gonna do a complete blood count with all the cells being hemolyzed? They all broken.
I just never thought of that. No, this is pretty
It
interesting.
is
Like
it's
seriously.
so many things. That's why, we try to make sure when we're at the school, when we're training people, these are the things that we are training them about. Drawing the blood in the right order. If it's a time test, you have to draw it on time. So we could be if a baby's crying, you might be crying. You might be That's raising certain hormones up in your blood, and now I can't get the right result, especially for people that have like maybe I'm gonna say Addison's or something like that.
Hmm. No, because I had got my phlebotomy license going through school. I got a lot of
Hmm.
certifications and things going through
Hmm.
for nursing. And I'm just trying to remember. I know it was ages ago, but when I was trained, or when we was trained to do that, don't remember them
Order of
telling
draw.
us anything like that. You know what I'm saying? Like, so, and maybe because I wasn't doing nothing farther with that, I don't know. But I just, they taught us how to do it correctly and things like that. But all the stuff that I'm asking you, like, I don't remember even having any type of conversation like that. So that's just pretty interesting. And maybe it wasn't meant to go that deeper, however, but I just don't remember that. But that's good to know.
And that's because too, so like with nurses, you get the front end, like the front end, they teach you how to draw blood.
Yeah.
And they don't teach you the stuff that goes on in the back of the lab. Like again, there's
That's what I'm
weight
saying.
testing.
Yeah, that's what I'm saying.
Yeah. And so you might do a urinalysis.
Yeah.
But they're not teaching you that you need to draw the tubes in the right order.
And that's what I'm saying. Like, because maybe I'm not going for
You're
lab.
not
I
correct.
didn't get that information, but that's very interesting. That's
Right.
very interesting to know. What actually happens behind the scenes after someone blood or DNA sample is taken? Just a short type of thing. What happens?
I'm gonna tell you what should happen.
What should happen?
I'll tell you what should happen, and then those scenarios that I just gave you are things that do happen.
Okay.
And so I've had to write grievance letters, and so if you like, okay, my sample was lost, you got to come back in and give me another sample. Sometimes they're not gonna say the sample was lost.
I'm about to say, they tell people that.
No,
Oh,
we lie. We good at lying. Very great at lying. So we don't tell you it's lost. We need you to come back in and take
It's
another
the real
test.
cut truth, y'all.
This is the uncut truth of the back of the lab.
Wow.
To get you some back of the lab.
God.
So what should happen is somebody should draw your blood, make sure it's labeled properly, and depending on where you at, you put it in the chute system, like the bank, the pneumatic tube system. You put it in the tubes, and it's supposed to shoot to the general lab, and then it's supposed to be dispersed to the department that is supposed to be tested in, depending on what test needs to be performed. Making sure that we check it in, just like you at the grocery store. We got a barcode scanner.
Yeah,
scan that, and Savannah test. So with Epic, you get to see that in real time. Okay, they just got it in the lab. Especially if it don't got no stat on it or anything like that, you go in the order of the queue, which it came down. If it's a stat, you get to skip the line, and then because the doctor is gonna be calling looking for those stat results
for sure.
And so after that, it gets checked in the next department that it touches, and then whatever tech grabs that bag and begins the process. We open up the tubes open up. So sometimes you can put those tubes in the pneumatic tube system and the tops will pop off. We don't have a sample. So
wow,
there's a lot of things going.
So inquiring minds wants to know. So that happens, right? And this patient is, I don't know, very sick, or this patient is out of town for the next month. First, will you guys know that? And secondly, would you guys do everything that you can probably, because it's already probably contaminated as it spilled over, but would you guys even try to get anything, you know what I'm saying, if it's spilled or anything, or
it's contaminated?
Completely lost?
Yeah, you got to come in with a new sample, something. And so then they call them an irretrievable sample. It got to be something that we can't get another one of, like maybe a spinal tap, or a irretrievable sample, like for a real specific test, something that's just so outlandish
that can be like not deadly, but that could be deadly to the patient taking it, and they probably don't want to repeat the procedure again, and so
Or
like
we
things like
can't
that, or
get
you
it.
can't get it
It
again.
could be a biopsy.
Yeah,
We're
so
not going to go back in and give you another surgery to get a biopsy of your
yeah,
liver. And so that would be considered an irretrievable
yeah,
sample. So in that case, we got to go to the pathologist and say, hey, she dropped this, they left it. And not that they dropped it, but it was sent to the wrong lab or something along those lines. Are we still able to use it? So certain tests need to be performed in an hour, 2 hours. It's just whatever test it is. And so it's so many tests that can be performed. We actually have a dictionary on different tests and the procedures that are performed that could be performed on those different samples. And so it's a lot. I couldn't even remember them all if I wanted to. It's that many different tests that can be performed on any one sample. And so we would have to go get permission from, we got to call a whole meeting. Can I still use this? It was a hour late getting to the lab because it was lost on the floor somewhere. I got to call the pathologist and ask permission. And the medical director, those people are not easy to get a hold of in the back of the lab. So where's the medical director at? He might be on the scene doing something else. And so, and you, in certain instances like that, you may be able to use that because we're gonna put it's an irretrievable sample. We're not gonna call the surgeon in to come get another biopsy. So then in an instance like that, then they'll override the time limits and say, yeah, go ahead and test that.
Yeah. That just reminded me of, and I'm going to be researching because I want to look. I'm going to research behind the scene labs type of stuff, and I know it's probably going to be a lot of things, but this just brought me back to I had an infection, and from my body, sometimes depending on what I eat, what I'm exposed to, whatever, I can carry my own bacteria will cause me to have infection.
Yeah.
Right. And so I remember I had an infection, and my doctor, she had her book. She'd been a doctor for years. She had her book that she carried around with her, and it was certain type of medications that she can give me for this specific infection.
Right.
And because I'm allergic to all what word am I looking for? Antibiotics. I could take clindamycin, and I think it's another one that I could take, but because I'm allergic to so many, she did not know what to do with me.
Right.
She's like, I don't know what to do with you. We're probably going to have to send you in the hospital and give you IV of X, Y, and Z. And that at that moment, I was like, I got to be careful with any and everything that I do. I'm talking about from eating certain things to sharing certain things with people, from eating off of me to just, being sexually active, because at that moment, I knew if I caught something, it would be very hard for them to treat me, and I would have to go to the hospital. That just made me think of that because she had a book and she was looking at all the different type of medications that could be used for me.
Right.
And I couldn't take anything, but she came up with a remedy and it worked. But I was like, oh, how did I get this? How could I have got this? And it was like never again, because it's hard for me to get treated.
Right. And I'll just definitely say that lab is no place for ego. You don't want to, especially you got irretrievable samples.
Yeah.
And we generally treat all samples as they're irretrievable because nobody wants to call and say, hey, I lost it. It got damaged in the tube. And so you are very careful with all samples that come through the lab.
Yeah.
But, and again, like I said, we have a whole online dictionary of different tests that can be ran for any certain thing, different combos, because you got very specific tests. Like when we talk about DNA tests and genetics and all of those different types of tests like that. And so it's not a one size fits all.
I'm very interested in it because I know when I was in school, I used to be in a lab and we were doing certain things through the microscope for things. And it was very interesting.
Biology.
It was chemical biology, biology, and something else.
Immunology, hematology.
I can't remember. It was so many years ago, but I know I had like 3 labs. But it was pretty interesting. So yeah. From your experience, what are the biggest reason for delays, technology, accuracy, or something else? I know you told me all the crazy mistakes, but is there anything else that plays a part in the technology or the accuracy?
Technology wise, the biggest delay would be somebody didn't put a label on your tube.
For technology, really? Wow.
Yeah. So they didn't put a label on there, or it's mislabeled. They put it on there wrong because most labs are automated now. So that's why that relates to technology, the lab. And so all those tubes are getting ran through.
Okay, I can see how you can say.
Yes. They're getting ran through the analyzers, and the machines are doing it by itself now. And so if the label ain't on there correctly, it gets pulled out of the line. It's like an assembly line now in the back of the lab. It ain't. You see the scientists, you see the technologists doing it. It has to be something very specific that can't be done on the line that one of those laboratory scientists would have to take off and actually perform.
What about accuracy?
Accuracy?
Yeah, what would be a delay in accuracy?
I'm gonna go back to the front. We always go to the front. I'm in the back. We're gonna blame the front every time. Again, the label. We have lab wars.
Oh, my God.
That label is so important, and people think it's not. And so the label it kicks everything. That's what starts everything off. I need a label. I need a person. I need to be able to match the specimen with the person. So sometimes even urinalysis, you can get the cups.
Yeah.
And somebody might put that label on the cup and not on the bottle. And so if I take that cup off, whose specimen is this? Nobody knows. So I gotta throw that out and call and see if the person is still up front and give me another urine sample. So
I can see that.
Yeah, all the time. It has to be on the tube and not on the top.
I definitely can see that. And I have seen some on the top. I used to be like, are they gonna break it or whatever? But I have seen it like that before. How do you respond to patients who has anxiety, that's scared, and just want answers right now? Like they're waiting on their test results to come back and they still not back. And they got all this, going on. How do you respond to them?
Remember now, I'm the director, so I'm back here doing paperwork now. I'm a graduated from the line. But as a phlebotomist, when I worked, the front of the lab, I would, let them know that their doctor give them a call. We can't get them results out over the phone. And so people still think you can, like they just call the lab, I need my results, because they do have anxiety. And so you cannot.
That's why I'm so glad I got a great relationship with all my doctors. They tell me what's going on the phone. They know
me.
Yeah,
they breaking protocol, but yeah,
I ain't gonna tell you who they are. But yeah, no, that is.
I ain't gonna tell you who mine are.
They won't tell you, but yeah.
Oh, we know. But my chart makes it much. Epic makes it more user friendly and friendly for the patient friendly. I will say, to get those test results right there online. You sign up for your my chart. And all the hospitals communicate with each other now. And so you can go right into my chart and get the answers that you're looking for. A lot of times you get them before the doctor get them, and you'll get a notification before the doctor get it. And so use that my chart.
Yeah, I can say that I played with it before, and it was very interesting. It had me on it for like some hours because I'm like, it's here, so there are tabs and all the things you can go through.
Yeah.
It's pretty interesting, but it can become overwhelming for me because it takes up a lot of my time, and I'm looking at things that I don't want to look at. I'm doing a deep dive
because you in healthcare,
and so I'm like, but it's very unique. It's very helpful, and that is true. You can get your test before the doctors will get it. So if I have anxiety and I'm scared and I'm calling, and you like, this person keep calling, do you then call the doctor or call the doctor assistants or the nurse and be like, this person is XYZ, is there any way that we can put a rush or do you guys do any of that? It does not. You just kind of like,
get so many people with anxiety.
Oh wow.
Everybody calling thinking they're dying.
Yeah.
Everybody think they're more important than everybody else.
Yeah.
When you got somebody else, sitting right here, that the people are in the hospital, you're gonna take precedence. If your doctor put a stat on it, I will tell you to call your doctor and tell them to put a stat on it if you want your results sooner. Otherwise, you got to go with the queue, the order of time that it takes for us to actually perform the test.
I got a question, and I know this is probably not your part. Probably 100% know this is probably not your part, but I know that you have an answer for me. Why do they always say if you do not get a call, do not worry about it?
Because we still probably performing the test.
No. Like, you know how when they say if we don't call you, you good. Like, don't worry about it. You know, you good. Like, we don't call you and say that it's anything, then it's nothing. You heard that before, right?
Not in the lab. We
Oh, they
remember
don't say that in the
we
lab
precision. We accurate. No, we're not gonna.
because
No,
the doctors do say that.
that's the doctor. No, we
So
not in the
y'all
lab. No,
okay?
where the
Alright.
results at? We need concrete. Your results. Your test has been performed, and we put the results in the system, and we done with it.
Okay.
In the back of the lab, we hardly ever have any patient interaction. Most of our
Yeah, I can see that. I can see that.
interaction is with the nurse, the doctors, the pathologists, and maybe some other labs that if we are doing more high complexity testing.
Okay, I can see that. Let's move on to accuracy versus speed, right? Education, trust, and building. Why is accuracy more important than speed when it comes to these tests?
You want quality over quantity. You don't want to give the patient the wrong test results. You don't get it. You want to make my job. Everybody in the hospital depend on my job. So most 80% of diagnoses come from lab work. And so I don't want to make your doctor, look like he's not doing what he's supposed to be doing. I'm giving out false results. I'm giving horrible results, near death. And again, the patients with the anxiety, not going to perform the test wrong, which gives skewed results, and you're waiting for them.
Yeah.
And they call them false positive, a false negative, a false positive.
Yeah.
And so, who wants that result? Like, I'm giving you a false, you got HIV today, and then have to call you back tomorrow. It was a false positive. Who want that?
So would
don't
you
try to catch me from coming out the lab.
So would you call that would you say that has more of a moral code because you don't believe in speed over accuracy? Because you know some people are like, some people will do that, you know, trying to get it done and all
and
the
so that's
mistakes
why
happen.
we always say all those horrible results come from the front of the lab. The back of the lab, we gonna take our time. I ain't gonna say what else we're gonna do, but we're gonna take our time so you can get accurate results. We might go grab coffee, go to lunch while your results are cooking in the oven, and
you gonna have my supporters like, what is going on back there in the labs? Hey, they said that y'all be doing X, Y, Z back there.
They definitely do. Oh my gosh.
I can imagine.
Things that happen in the back of the lab.
We're gonna have to do an uncut on glamorous conversations for that one. What could go wrong if results were wrong? I think you already answered that. Yeah, you did already answer that.
I did, but I can break it down
Okay, go ahead.
little more.
Yeah.
So, like, okay, you get a lot of stroke patients. They got to go on anticoagulants, stop their blood from clotting.
Yeah.
So if those tests are performed wrong and you get too much warfarin or Equus or whatever it is, it's a medicine. It's a medication.
Okay.
And so blood thinners. I'm gonna just say blood thinners. What is that medicine called? I want to Google it.
It's okay.
That's not my area. That's not my area. I'm gonna just say that's not my area.
Okay.
But you're gonna get too much Coumadin, warfarin, those blood thinners, the anticoagulants. Now, if I make your blood too thin, you're gonna bleed internally, you're gonna bleed out, and you're gonna die.
So it can result in death.
It can result in death. A lot of things result in death in the lab and being very accurate. So we have to be very accurate. I don't want to, you're going to get called in the office and I got to do this grievance and report saying that you followed protocol and no errors on our behalf. We followed procedure. And I really see, and exactly, but my job is to cover the company.
Does that happen? Has that happened a lot? Do it happen more often than normal?
I'm gonna just say I'm not allowed to say it happens. It definitely happens. I can't say it happened at my lab, but I'm gonna just say it happens.
It happens.
It definitely happens.
I can see that happening.
And parents file grievances all the time, wrongful death. You know it happened.
I do.
Yeah, you know it happened.
I just wanted you.
You wanted me to say it. I'm already controversial. Don't make me. Yes.
Okay, we're gonna stick with yes. Okay. Can results ever be inconclusive, and what does that mean for a patient?
Yes, they can absolutely be inconclusive. So, lab is lab, and we sometimes things is just we don't have an answer for it.
That's what it is, right?
So like COVID, nobody knew what that was. We had to create a test to detect that, and that test was originally a test to detect HIV, and so we had to modify.
Really?
Yes, those were the original HIV tests that they used for COVID. So we had to modify that test to make it fit a COVID. And so, inconclusive, yes. And what does that do for the patient? It's just send you back to the drawing board. They didn't find anything. We didn't get any results. That test showed nothing.
So more delays.
Yes, it's just more delays for the patient. And so the red blood cell was normal, the white cells was normal, even though you got autoimmune and your white cells should be elevated, but they're not. And it depends on what, again, which diseases. It's so many variations. You got to really know what you're doing in the back of the lab.
And even if you do know what you're doing, if you got a bad day, like you throw it off, like you said, things can happen, right?
Things can happen. Another reason that I started the school is when I was the lab director. I'm not going to say where I was the lab director, the lab manager at. Yeah. But it was always a shortage in personnel, and we cut corners like everybody else.
Don't say everybody else.
The nurses. Oh my God!
What you talking about?
Like everybody else. So we might got something sitting on ice a little longer than it should be.
But I could see that happening though. You know what I'm saying? That goes what I was saying. If it's understaffed and people want to go home and people got families and got other engagements to do, so I can see that happening. No, I'm not agreeing with it, but I can understand that happening. So then that doesn't really fall on God. That falls on upper management. I'm gonna leave that where that's HR.
They supposed to be out recruiting and making sure we have enough staff. And if they're not recruiting and making sure we got enough staff, sometimes HR standards are way higher than we need them to be. And so I could tell a person to apply for a job, and if it's a person like I used to go, I'm not gonna name names, or I used to work at the complex, and it's 3 different employers at that one complex. And so I would go in the basement during lunchtime to steal their employees to bring them over to me. And I'll be like, okay, instead of y'all working over there, I need y'all come work over here with me. And so they will put their application in, and I'm like, did you put your application in? And they were like, yeah. I'm like, oh, instead of, the HR specialist coming up with the credentials or whatever to pull that person up, I would literally have to tell them, go get it out the garbage bin, to this person is very qualified. She worked over there at that other place. And I, set me up an interview with her. I had to specifically go request interviews for certain people. And it's a lot of people don't know that when you put an application in, you need to make sure your application got those keywords from my job description, or the computer is going to throw out your application.
Yes, it's really funny that you said. I'm going to touch briefly on this. 2 things. For me personally, just being in school for 5 years and all of that stuff, I think school is necessary for the basics, right? So like medical terminology, certain things, but I do not feel like you should be in school all them years just to go to a career that they're going to be able to teach you anyways. Because everything that I learned, I don't even use medical terminology. Okay. I can't even tell you when the last time I used medical terminology, but I understand it. Some people do use it. Some people don't use it. But at the end of the day, I feel like you want to learn your best on the job. So they shouldn't make those things that high to where people is not employed. That's why a lot of people are not employed, because they don't have their requirements that they want them to have, when in all, actuality, they can learn on the job.
Right. And that's too, like, again, with my program for the phlebotomists, we teach them medical terminology and medical assistants. We teach them that, but you're more patient-centered, and you working with patients all day long. Yeah. And so I don't need to have that high-level vocabulary, because I'm working with patients. I'm working with homeless people. I don't have to have all that vocabulary to inform the patient of what they need to know. I always tell them, make sure you're speaking in layman terms, general terms. Act like you're talking to one of your friends, but don't get too,
or kid.
yeah, like exactly.
So
Right. Me in the back of the lab, I use medical terminology all day long. It's a necessity because now I'm working with the more on the provider side. I'm speaking with doctors, I'm speaking with other laboratory personnel. And so that's how they speak. So you always got to know your, see, but you on the patient side.
no, I was gonna be sick because I dealt with
Know your audience.
know your audience. I dealt with the social workers and the doctors and the insurance people sometimes, and I was just gonna say even the doctors don't even be using medical terminology. So that's what I was gonna say. But I know I had took a pharmacy class, and I'm talking about it was like 6 syllabus words. I had to learn how to read, write them, say them. I said I'm probably never gonna use this word a day in my life.
Right.
I don't feel like that. I think that's a waste of class. I don't want to be honest, but yeah. So that's
you should have knowledge of it.
You should have knowledge of it, but we still. I used to carry a book on the floor. Like, who's going to remember all of that stuff? I still have my book to this day.
Me
my
also.
medication book. So
for the different different tests,
we like always EDTA, refer back to things. Yeah,
different
for sure.
types of tubes. I'm like, what does that word mean again?
Things are always changing. Always changing. So we're gonna move into impact of treatment, value plus clarity. Yes. Right. So how do genetics and biomarkers result actually shape a patient's treatment plan?
Genetics and biomarkers,
whichever one.
It just gives you more personalized, specialized treatment versus that general treatment that I'm gonna throw it all in a sink and see what works deal versus I know what I'm actually looking at. You do have certain biomarkers, and so I can target those biomarkers and treat it according to the biomarkers. It's not like it's a shot in the dark now. So if I don't have those different biomarkers present, I don't know what I'm treating. So many autoimmune diseases, they look alike. They with the inflammation because the body is attacking itself. And so many of them look alike. Many of them present the same symptoms.
Yeah, for sure.
And so I don't want to treat you for rheumatoid arthritis, but you got regular arthritis, or you got regular arthritis, but you don't have, I'm treating you for regular, but you got rheumatoid. It's two totally different treatments, and what would work best for rheumatoid is not always going to work for a regular arthritis.
Yeah, or even I can even personally take it to another step. First of all, one medication is used for multiple different diseases. Absolutely. Let's start there. And it could be an autoimmune or not an autoimmune disease, right?
Yes.
Just like prednisone is used for autoimmune diseases, but it's used for asthma and other type of things, right? So I say it to say, like, our doctors are only as good as we are to them. It takes both, because it's so many different medications that you can use for the same disease. But some medications don't work with the person's body. You understand what I'm saying? So then you have to be at home and you have to journal how you feel and all of these things, because it's different medications that could try. It's trial and error in everything. Because if they knew everything about treating us, we would never be sick. You understand what I'm saying? So we have to work with the doctors as well, because they go off of a chart. Nurses go off. A lot of people go off of a chart.
Absolutely.
Depending on what your symptoms are. You understand what I'm saying?
Yeah.
And so what makes a good doctor, a good nurse, or good anybody, they take it a step farther. You know what I'm saying? You listening to the patient, you coming up with a treatment plan that actually works, but the patient actually have to take the medication and actually let it get in their system. And sometimes the medication will make you feel horrible, but that doesn't mean it's not going to work. That's why they tell you at least try for 3 months. You understand what I'm saying? And if it's still like that, then we can switch you. But we do have to do a process of elimination. Like you said, we just don't go to doctors and they just going to fix us up. We are as important piece to their ears.
Right. And you have to advocate for yourself and your own health care. And just piggyback off the medications, we have so many medications are deemed available for off-label use. And so you might have a blood pressure pill that maybe work for erectile dysfunction. So you have to also look at those studies. And so it's different studies. And
it's called reading. You are entitled. I just told one patient of mine, you are entitled to your after visit summary.
Mhm.
That's going to tell you what you came in for today, what they did with your blood pressure, your pulse, all of the things with your follow up, what you need. It's going to tell you everything.
Yes,
And if you need to go a step farther, request your medical records. You are entitled to that.
absolutely.
But the thing is, people do not read, and sometimes doctors do not tell you everything that you are diagnosed with,
Right.
which is another
The way
crazy
they,
part to it.
but the way they've set up healthcare, doctors get 15 minutes per patient,
And we're
That
not
is
going to
not
even
enough
go.
time.
That's not enough time, and we're not even going to go to that. But that's why a lot of doctors start their own private practice. Because, like,
Yes.
when I go to the doctor, we be in a room an hour, sometimes 2 hours.
Yes, me and my doctor as well. So I'm like, and he know if I'm coming to see him, he gonna clear the calendar now because you medicine, I'm lab. We got other stuff to
Yeah,
talk
we
about.
talk that it's like family, and that's what you want to
Yes,
do with your
absolutely.
doctors.
Yes.
To touch just a little bit on this, I have a patient that's always, it's always somebody else's problem
Mm-hmm.
if they doesn't do what she wants them to do. And I told her, you got to stop doing that, because what you are told and what you're used to, certain doctors only have the ability to prescribe certain medications and certain tiers of medication. You know what I'm
Mhm.
saying? But if they doesn't do what she wants them to do or request and she doesn't like them, she call it been a problem, but she's really the problematic person. So I am the person that communicates between her and her doctors.
Mm-hmm.
And people are like that.
Mm-hmm.
You can't be like that. Not if you're trying to be treated. And doctors can refuse to treat you
And they're gonna put
if
it in
you
your
are
chart.
being a problem.
Yeah.
So, what breakthroughs are happening right now in medicine that people should be excited about?
So I always tell patients like this, coming from the lab,
Mm-hmm.
the medicine the doctor got you that's treating you with now
Mm-hmm.
for the lab and research is already old. We are already doing tests and trials on a new medication
Right.
that treat the same thing and better. So it's always some clinical trials that are going on in the back of the lab. We doing research. And so I always tell people, like, especially to get the most current treatment for things, volunteer for a trial. And so everybody always like, oh, I'm gonna be missing a toe or a finger or whatever. I'm like, it's so many people that come in and do those clinical test trials, and they're very successful in their treatment. But again, the things on the floor that by the time it get up to the doctor, after we have to do that research to see what's going on, what is this, what does it look like, the morphology of different diseases, and by the time we finish studying it,
Mm-hmm.
and it goes upstairs on to the next trial. So we already got some new medicine that could possibly treat the same thing, but we have to test it out.
Yeah, I'm glad that you said that. A lot of doctors sometimes don't have the time to even tell patients that they qualify or that they are allowed to do these trial studies. And some people, especially black and brown people, don't know about this thing, and that's where the disconnect come in from, like, researchers and certain doctors to the primary care providers. Like,
Right.
it has to be a communication bridge there.
Right.
I had the liberty to do a trial
A
with
clinical trial?
a clinical trial with
Yeah.
the ballista.
Mhm.
So at the time that they were doing it for me, I didn't know if they was giving me a placebo or the actual medication.
Mhm.
And to turn out, I was doing very well on that, but they was giving me the actual medication. And so
Yes.
when it came out to the public, I had already been on it,
Yes.
for a long time. So I think those clinical trials are very necessary, very needed.
Mhm.
And I think people need to put it out there in the world more,
Yes.
because people don't know what they don't know.
Right.
People don't know what they don't
And
know.
we have so many stigmas around
We have so many-
medications
yeah.
and doctors, but clinical trials have come a long way, and I would encourage you to do them because they make a difference.
They definitely do. We're going to go ahead and move on to access and equality.
Mm.
Are these tests assembly to everyone? I'm sorry. Are these tests accessible to everyone, especially in underserved communities?
They are technically available to everyone, and they should be available to everyone. but because you make the type of insurance, so the type of insurance you have, your insurance can deny.
Yeah.
And so insurance sometimes get to play doctor, and it could be against your doctor may have prescribed you the best medication.
Yeah.
And so the insurance company can say, nope, that's not in their tier. We're not going to cover that for them. They need X, Y, Z. All of these things going on. We want them to try this medication before you give them this medication. Then they got to try this one before the insurance company will actually pay for it. And so also too, you want to make sure that on your when the doctor call in a prescription, put on there no generics. Because now Walgreens gonna say the pharmacy and the insurance company interferes with the way medication is the way medicine is being practiced.
Yeah.
So Walgreens can say, I get a better deal on this. We gonna fill it with acetaminophen versus regular Tylenol. And the pharmacy, they well within their right. If your doctor don't put on your prescription to only fill with the original and not generic medication. So that's something that you can always ask for again with your doctor.
And sometimes you got to be careful with that. And two, like us as the people are entitled to switch our insurance as many times as we need is necessary to get a specific doctor we want or
right.
a certain type of medication. And people don't know that.
Mm-hmm.
What barriers exist when it comes to getting proper testing and diagnosis? That's like a fully loaded.
It is very loaded. Now you got me answering a lot of loaded questions today. I done told the lab secrets. I done told the phlebotomy secrets, the hospital secrets.
You'll be all right. You'll be all right. You're right.
Oh, barriers to healthcare or testing.
Yeah, getting proper testing.
For me, one of the main barriers to testing is the doctors simply don't have enough time to sit with you to hear all of your concerns to make that educated guess. So you done told him the first, I'm tired, I'm fatigued, I got inflammation, I might get the butterfly patches on my face, and he gotta try to pick which disease he want to treat you for. So because it's so general, they're going to order those basic tests. They're not going to order them expensive tests. Like, let's get past these ones first. Everybody get a CBC. They like Oprah passing out cars. Everybody getting a CBC.
No, you didn't just say that.
Blood count. You get a complete blood count. That's the first test they're going to do when you come in the hospital, present with anything.
That was cute. And it was loaded, but you answered it perfectly.
Thank you. I appreciate it.
You definitely did. What changes do you think needs to happen in healthcare to make the process better for the people?
Another all the loaded questions.
You can be sure.
Mercy.
Hey, listen, this is what I gotta give to the people.
To make it better for the people also need to be informed. If you don't want to use Google, your doctor does have tons of pamphlets and brochures for you to read about your situation. There's always medical journals online that you can go read and order that is specific to your condition, because again, we want you to be informed. The doctor wants you to be informed. That makes my job easier, even as the laboratory tech. That makes our job so much easier if you inform. It cut out on the time. Since they have limited the doctor down to 15 minutes, I be just sitting in my chair crossing my legs. It's 15 minutes already. I'm not finished. And so if I come in informed like I do when I have my appointments, it makes it easier for the doctor to order those proper tests. So education is one of the biggest things that I believe is a barrier to the treatment. And also too, again, knowing I don't have to take this. I don't have to accept that treatment. And just because the hospital said he got to see you in 15 minutes, like you just said, I'm sitting here an hour. For what they charge, give me my hour. This is not, they running us like we're a warehouse now. And so they getting them through, they herding us through the doctor like cattle. everybody mind don't work that fast, and the doctor then got older, and everybody that mind does not work that fast. This is don't treat us like it's the car wash. Give everybody their allotted due time. Allow them to voice their concerns, but now they keep going. Well, I had this again. Some people start going in a circle.
Yeah.
And like, okay, all right, I got it. Let me order these tests. I'm gonna order these tests for you, and I have another patient waiting, or whatever, something. But education is the biggest barrier to healthcare, and even everybody got forward card. If you act like you don't know, they're gonna treat you like you don't know. Because they figure out I can cut time with this patient because I know I'm gonna spend an hour with that patient. And so
don't point at me.
And so let me go ahead and cut time over here, give her full attention, and keep going. I got some doctor friends that stay in the office to midnight doing they charting because they would rather spend their time doing the charting and speaking with the patient than trying to rush you out of there. And so it's educating, and we don't advocate. We can advocate. We can lobby. It's so many different things. You can call the medical review board if you get too mad, and that's going after somebody's license, and then they got to look at make sure that these patients are being treated. Everybody's being treated fairly across the board. And if they find discrepancies, then they investigate them and they do process improvement based off your concerns. And I can tell you those surveys that the hospital sent out. I was part of that community committee. We sent out surveys, and based off those surveys on what the patients put back in there, certain changes do get made within the hospital or whatever facility that you're working at. So fill out those surveys. And they definitely work. We take them into consideration. We have meetings, 50 people in a meeting, looking at all these surveys, coming up with sophisticated numbers so that we can do best practices for the patients. Even though we got to fight big pharma, we got to fight the insurance companies to give you that care that you deserve. And I always say the money green. My money green. My insurance card is gonna pay certain, benefits. And so treat me like you would anybody else. But again, the insurance get to override the doctor. Walgreens get to override the doctor and say, I'm only we can get this in bulk for cheaper. This is what we're using.
Yeah.
And this is what we're filling it with. And the insurance company can say, yep, you got to do a trial of 5 more drugs before you get to the big drug. And then you look at that. Well, while you wasted time, you making me take 5 different medications for 5 months. You spent enough money just to give me the big one. They don't think.
Yeah, because they're not aware of that. So again, I used to be one of those people that did not fill out them surveys. I don't know why I don't like fill out the surveys, but you guys fill out those surveys. She already told you what you can do and how you can do it in the process to go about when you're having issues with doctors and things of that nature. So I hope you picked up on that. We're going to move on to closing. If you could leave our audience with one message about patients, healing, and understanding their health journey, what would it be?
The health journey, complicated. One message. Listen to your body.
That's a big one.
Clean your body out. Detox. Cellular resets. The clean, because we got so much junk in our cells.
Yeah.
And so on the cellular level, sometimes the message doesn't always come through from self. Listening to your body, it speaks to you. But when you got a lot of cellular debris, those signals get crossed up.
Yeah.
So you might be craving, I don't know, I'm gonna just say water, but you craving, your body actually want water, but in your mind, the only thing water that the body knows of is those sodas that you drink. And then you wonder why you drink 12 sodas, because your body trying to tell you, I want some water,
Yeah.
something liquid, but it doesn't know how to say it because all of the signals get thrown off or misconstrued because of all the junk that we put in our bodies.
For sure.
So we have to be mindful of what we put in our bodies. And I think like everybody should detox at least once a year to clean out our cells and have that cellular reset so we can really hear what our bodies is trying to tell us.
For sure. For sure. Our body does talk to us. And how can people contact with you or learn more about the work you're doing? How can they contact you if they want to contact you?
So we do have a website.
And what is that website?
www.alliance health inst.org, and the phone number 414-269-9498, and that's the number to the school. And I have to put my disclaimer here: I don't treat, cure, or diagnose. I am not a doctor.
Thank you so much
Just
for that.
a laboratory professional.
Thank you so much for that, Tom. If you can put that the number in there and her tag or the email that she just gave, put it in there, I would greatly appreciate it. So before we go, y'all know it is April Fool's Day, right? So I got a host of my friends, just to name a few: Antonio Lucky, Kenda, JJ, Savannah, Bree, oh my God, Charlene, Deshani.
You don't know what
I have got everybody, and what I said to everybody today, I texted them. I said, I can't do it anymore. You are not for me. You are really against me. I can't believe you did this. I thought you were a good person. I done sent it to Jonna. I sent it to everybody. Everybody was like, what are you talking about? I thought we were cool. X, Y, and Z. I got everybody today. So I April Fools everybody. So I was very successful. I got you. You didn't know what I was talking about. Everybody was like, did you
I was
text?
about to take my lab coat off.
Everyone was like, did you text the right number? Yes, I text the right number. And I purposely made y'all wait a long time before y'all responded.
Exactly.
I'm going to be putting up the response that everybody said. Oh my God, it was so funny. So, April Fool's Day to you guys. I hope you guys did a safe joke, nothing really too crazy. But again, I am Savannah Burks. I'm your host of Lupus Has No Face podcast. We are here every Wednesday at 6:30 Central Standard Time. Now, remember, if you are looking for the Guide Living Well with Lupus and the journal, which can be purchased on Amazon, and for faster shipping, you can go to the SavannahBurks.com or the Lupus Has No Face website. And do not forget to register for the walk that is coming up May 23rd. You do not want to miss this. DJ Boogie gonna be in the house. B Jones is going to be there. We're going to have a host of beautiful people that's going to be there for entertainment, for our walk, and etc. So make sure you go ahead on the website. It's $25 to register. If you want the bundle deal, it's $35. The walk is May 23rd. So hope to see you soon. Until next time.